Hey Mama, welcome to Parently. Thank you so much for watching this live stream today. We want you to stick with us all the way through. We're talking about how to pass your glucose challenge screening and what happens if you are diagnosed with gestational diabetes. So before we get into this, definitely click the link below at the end of the video. Sign up for our free online pregnancy coaching class. You don't want to miss what you will learn in that class. So, Dr. Boyd, what happens when we eat sugar?
All people, whether they're pregnant or not, whether they're men or women, have to have an ability to feed your cells. You've got billions and billions of cells in your body. If you don't feed them, they die, and then you die as an individual. That is the purpose of insulin. Insulin is a hormone chemical that's released from your pancreas. Your pancreas is an organ that sits up in your upper abdomen. It has a host of responsibilities, but one of the most important is to release insulin. So insulin, if you can imagine, is a gatekeeper. Just like in a jail cell, the gatekeeper opens the cell door to allow you as a prisoner to come in or out. Insulin does exactly the same thing. When it is released in the body, it allows the cell door to open, the food that you've just eaten to go inside the cell. And the interesting thing is, at the end of allowing it to go in, it shuts. Now, if you have more food or the insulin is higher because of more sugar, that means it stays open longer. You feed more cells, or you feed the same cell longer periods of food, and that's where the potential for obesity comes to be.
Okay.
So without insulin, the cell door doesn't open, you die.
Right.
So somebody that has insulin or that has type 1 diabetes, that person cannot produce insulin, has to be given insulin for the cell door to open, versus the normal person where that cell door opens, the food goes in and it shuts.
Okay, so we have all this sugar that we've just consumed, a glucose, so it might be a processed sugar like we're going to talk about in a minute, or that sugar could come from a simple carbohydrate that's in our bloodstream. The insulin opens the door, it goes in, and then your blood sugar goes back to normal. So with a diabetic, you said with type 1 diabetes, but then there's also type 2 diabetes and gestational diabetes. What is the insulin? What's wrong with the insulin in the type 2 or the gestational specifically, because that's what we're talking about?
So diabetes in general is a sugar problem. There's type 1, that means that they have to have insulin to survive. Type 2 is a resistance problem. And it becomes very complicated to explain this, but the bottom line is the insulin doesn't do what it's supposed to do in the cell. It's resistant to opening the door. And so you need more and more and more insulin to allow that cell door to open. So the analogy would be that the cell door is heavy, and you need more insulin to get it open to feed it. Well, what happens is, as the insulin's higher and higher and higher to get that cell door open, that means the blood sugar that you just consumed stays in your body longer and longer and longer, and that is what is a potential for causing elevated blood sugars that can damage your eyes, your kidneys, your extremities.
Okay.
So it's a resistance problem. Gestational diabetes is very similar to type 2 diabetes. Some people think that gestational diabetes is a precursor to developing type 2 diabetes later in pregnancy or later in life.
Okay.
So type 2 resistance, that parallels the diabetes in pregnancy. That is very, very totally different animal than type 1 diabetes, which is a requirement to be given insulin versus type 2.
Okay, so if a mom were to have not enough insulin, the insulin is resistant to opening the door and her blood sugar stays high, what would that do to her baby while she's pregnant?
Well, just like if you consume too much sugar, too much food, too many calories, the same thing applies to your baby. So if your blood sugars are elevated longer periods of time than they should be, that sugar is going to go to your baby and grow your baby. Well, the normal sized baby is around 7 to 7.5 pounds. You can deliver most of those babies vaginally. But if your baby gets too big, it won't come out vaginally. So what is that magic number? Well, you don't want to test it out. You don't want a baby that's 8 or 9 or 10 pounds. The other thing is babies that grow like that have an increased risk for dying in utero. So babies of gestational diabetic moms, especially if they're not controlled with either diet, pills, or insulin, those babies are increased risk for dying. So they have to be monitored closer than a baby that's not a diabetic.
Okay.
The other issue is after the baby comes out of the uterus and it's been exposed to all this sugar, and then you remove it from all that sugar, sometimes that baby's blood sugar will crash in the nursery. And that baby then has to have IV fluids, IV sugar, so that it doesn't get into trouble.
Yeah, and they can also have metabolic disorders in the future. Is that correct?
That's correct. So babies that are born, especially babies that are born of gestational diabetic moms, especially moms that are not well controlled, have an increased risk for developing diabetes themselves earlier in life.
Wow.
And again, that's something that you don't want to deal with.
Right. So it's very important that these moms, if they are at risk, are tested for it, and if they are diagnosed with gestational diabetes, to be treated. So what is the test that we do to screen for if a mom is diabetic or not during pregnancy?
So I mentioned earlier that all pregnant women now get tested. And we test you between 24 and 28 weeks, except if you've had several scenarios. If you've had diabetes earlier in an earlier pregnancy, we're going to test you before the 24 to 28 week mark. If you have a history of a relative that's a first degree relative, like a mother, father, we may test you earlier than 24 to 28 weeks. If you've had a baby that's been very large in a prior pregnancy, we may test you before 24 to 28 weeks. But it's important to realize that most women are 24 to 28 weeks.
Okay.
So what happens? Most offices do not do diabetes testing in the office. They send you to the hospital. And it's important to understand that 24 to 28 week is a test that is called a screening test. Screening means we are simply trying to determine if you should have further testing or if you don't have further testing. So it's not a diagnostic test. That's important to understand. So a screening test simply tells me as the physician, you need more testing. So the screening test occurs between 24 and 28 weeks. We have you come to the hospital and we give you a drink of some medicine called glucola. It's usually Coke flavored, orange flavored, lime flavored. It's a specific amount, it's 50 grams. We have you drink that, and then we draw your blood an hour later. If your blood sugar value at that 1 hour mark is 140 or less, you do not have to have further testing. So you passed your screening test.
Okay.
If your test amount that's recorded is greater than 140, then you have to have further testing. That's the diagnostic testing that we talk about. Mm-hmm. And in that scenario, there's two types of diagnostic testing, and every office uses a little bit different scenario. Mm-hmm. One is called a 2 hour, one is called a 3 hour. I prefer the 2 hour because it's one less stick for you as a patient. So I want to go back to the screening test. There's nothing you have to do
Right.
no prep at all. Okay. And so you do whatever you want, you go in for your screening test. If you get diagnosed with a value of greater than 140, you have to have the diabetic screening, the diabetic test to tell whether you're a diabetic or not.
And the 140 is a value showing that your blood sugar is greater than it should be. So your body it's showing that maybe it's not doing what it should be to get that sugar inside the cells.
Correct.
So that's why you go to the next step.
That's why you go to the next step. So your healthcare provider will ask you to stay without eating anything. It's called NPO for 8 to 12 hours. Now, every office is a little bit different. I used 8 hours. Now, you can still drink water during that period of time, but you can't have anything that is food or anything other than water, okay? Now, you go to the hospital and you have what's called a fasting blood sugar. So they draw blood out of your arm. That's a fasting. That's before you have any of the glucola. Based on the office, you'll either have a 75-gram glucola or you'll have a 100-gram glucola. If you have the 75-gram glucola, they will test your blood 2 more times. They will test the fasting that we've mentioned. They will draw blood at the 1 hour mark and at the 2 hour mark. Those 3 values then, based on where they are, will determine if you're a diabetic or not. So the healthcare provider will look at those 3 values and say, ma'am, you have diabetes or you do not. If you do the 3-hour test, it's a 100-gram glucola. So it's just more. And then you get your blood tested at the 1 hour mark, 2 hour mark, and 3 hour mark. So you can see that the patient that has the 3-hour glucola has 4 blood draws. The patient that has the 2 hour has 3 blood draws. So this is the one most patients like. However, physicians are, like we all are, we're kind of creatures of habit. And so every physician has their own liking.
Yeah.
Now, it's important to understand that if 3 women have these tests, they failed the screening test and they have the diabetic actual testing, if 3 women have it done, 2, it's normal. So they do not have diabetes. Only 1 out of that 3 women will have diabetes of pregnancy, gestational diabetes. Now, in that scenario, they get referred to a maternal fetal medicine specialist. They're also called perinatologists. And if you live in a small town and you have to travel, it's unfortunate, but it's very, very important that you be seen by a perinatologist, a maternal fetal medicine specialist, because he will have to screen you and your baby and evaluate you much closer, because I mentioned you have an increased risk for the baby dying inside, so you have to be seen much more frequently. He will also determine over time whether your gestational diabetes can be managed with diet, with pills, or with the need for insulin. And it's interesting, most women that have gestational diabetes, most women can be managed just with diet.
Yeah.
And then the next group with pills. Very few women that have gestational diabetes require insulin. It is important to understand, though, that as the pregnancy marches forward, remember you get diagnosed at 24 to 28 weeks, so potentially you have 12 to 16 weeks where you have to be seen and tested. And as you move forward in your pregnancy, you have a greater chance for needing insulin, especially if your values were really, really high early on.
All right, so very, very important. But we want to help these women that are watching pass the screening. So it has, because maybe they don't know that they're at risk. So
Right.
we want to make sure that before that screening at 24 to 28 weeks comes up, that they have prepared. And it's not just about preparing a week before. And for all of the women that, think that they're not at risk because they're skinny, maybe they have not had a family member that has had it before, they've never really even heard about it before. I watched a video during my pregnancy about someone on YouTube, and I'm sure a lot of our viewers probably know Savannah LeBrant, who was this little skinny thing, and she was diagnosed with gestational diabetes. And I think a lot of people look at her and think, she's so skinny, how in the world? Like, she's not the typical diabetic. But it's not just about if you're overweight, it's what's going on inside with the insulin and what you're consuming. So let's help our viewers think about what they're consuming, what's healthy, and what's really spiking their blood sugar.
So Annabelle's exactly right. You cannot, a week before your diabetes testing screening, really change anything at all that will help you pass. Now, let's assume that you were on an all sugar diet for all your pregnancy, and a week before you get rid of all sugar and you just are on fat and protein. Maybe you could pass your diabetes testing, but it's probably too late at that point. So just like we are here to help you throughout your pregnancy, prior to 24 weeks, we want to be an educator so that you as a patient can have the best health for you and your baby for the entire 9 months. So let's really talk about what to do prior to that testing moment. So, interesting scenario. So, this is sugar. And all people are familiar with sugar. And very few people eat sugar this way. Some do. I've seen people take their coffee and dump 3 or 4 or 5 of these in their coffee. But very few patients simply take a teaspoon of sugar and put it in their mouth. I think it would be disgusting, but some people do. But again, so if I ask you as a patient, how many of these teaspoons do you consume in a regular day? And I actually just asked some of my nurses at the hospital this recently. It's interesting the number of teaspoons that they think they consume. First of all, people think that they don't consume sugar, and they really do, because sugar's in everything. We're going to talk about that here in just a second. But when I ask my nurses, who are healthcare providers, what they think they consume in sugar in a given day, most think it's between 10 and 15. 10 and 15 of these teaspoons. You're going to be shocked at this number. The average American, whether they're male or female, pregnant or not, consume 41 teaspoons of sugar per day. 41. Now, I challenge you. You probably don't even have 41 teaspoons in your house. Remember, a tablespoon is the big one. Teaspoon is a smaller one. You don't have 41 teaspoons in your house. Very few people do. Most have 8 or 12 or whatever. But if you can borrow teaspoons from your friends, from your family, I want you to load up, and you don't have to use sugar. You can use salt, you can use sand, but I want you to get 41 of these teaspoons and fill them up and put them on your table so you get a visual. That's what you're consuming every single day. That sugar, when it goes into your body as a pregnant or a not pregnant woman, ends up getting converted to fat. If you're pregnant, it gets converted to fat in your belly and in your baby's belly. So this is a crazy thing about gestational diabetes. Babies that are born of diabetic moms, especially if they're not well controlled, they have abdominal obesity just like the mom does. Because sugar that's not used for the cells, the extra gets converted to fat. And most of the fat occurs in the abdomen. Not only in the abdominal fat, the skin wall, but the abdominal fat that's around the organs inside the body. So you mentioned somebody on YouTube. She may be what's called skinny fat. So her external body is skinny, but her internal body, the fat around her organs, may be fat.
Right.
And it's very difficult to know if you're skinny fat versus fat fat.
It ends up in heart disease, right?
It does,
like
heart
that.
disease. That's right. So what to do? First of all, understanding how much sugar you consume, I think, is part of the equation. We're all visual people. And I think this is a great test.
Right.
41 of these teaspoons. Lay them out on your table and let your brain look at that.
Yeah. So let's talk about the World Health Organization. It doesn't say we have to get rid of all sugar. I mean, it is in everything, and we are allotted a certain amount. And they recommend 25 grams, which is about 6 of these. So to go from 41, and maybe not all of you eat 41 every day, but maybe more than 6, to take that down to 6 a day is a hard change.
It is.
And it's very important in your pregnancy, or if you're even preparing for pregnancy, to not just think about yourself, but think about your baby. You are now responsible to care for the health of your baby, who doesn't get to control what you consume. And so if you're at 41 teaspoons, see if you can half it to 20 teaspoons a day. And like Dr. Boyd was saying, this is in dissolved form in a lot of things. So your coffee, soda, fruit drinks, things that you don't have to consume to live. You don't have to drink a soda every day to live. And I know it's very hard when you have something that you just go to every day, but if you can cut that in half, and then from there cut that in half. So for 30 days or for a week or something, set a goal to say, I'm going to cut my sodas in half. And now I'm going to cut into a fourth, to really get down to those 6 teaspoons or less every day. So 25 grams or less of sugar a day. So make sure you're paying attention to things that have sugar in them. When you go to the grocery store, anything in the aisle that has been processed is probably going to have sugar added to it. Or if it's been highly processed and it's a simple carbohydrate, that means that in that carbohydrate, it's just a simple chain that can be broken down in your body super fast and just spike that blood sugar. So pay attention to the ingredients on the back. How much added sugar on the nutrition label? Look at the ingredients. Is there added corn syrup, added molasses, added just plain old sugar? So make sure that you know the different names of the sugar, and make sure that you know how many grams are added to that loaf of bread, that bag of popcorn, that canned soup, or jarred fruit, whatever it is. The best thing to do is stay on the outskirts of the grocery store, because in your fresh fruits and vegetables section, in the meat section, in the homemade bread section, possibly, there's not going to be any added sugar. But anything that has gone from the ground into a factory where it was processed and packaged is probably going to have sugar in it.
I think that's very important to understand, that looking at every label, I think, really is easy to do once you get in the habit of it. You simply turn that, whatever you're buying, over, and it will say, the amount of calories, it will say the amount of fat. Everybody's looked at labels to see what it is. Every single label, it's mandated by the FDA now. Every single thing, including when you go out to dinner, has to have the information of what's in it as far as the calories, the fat, the protein. So there's really no excuse anymore saying, well, I went to this restaurant and I didn't have that information. Mm-hmm. You can oftentimes it's on their websites now,
right?
But it's added sugar that's the most important thing to understand. A banana has sugar in it, but God put it there. So you can have a banana and feel good about that because it's not an added sugar.
So it would be considered closer to a whole carbohydrate. It's not just the sugar. There's enzymes, there's vitamins, there's a lot of fiber, and fiber helps slow down that sugar absorption into the bloodstream.
Right. So I give this, I mention this frequently to my patients. They'll say, okay, I had a glass of orange juice, and in their mind that was a fruit, there was no added sugar. However, I must remind you, when you drink a glass of orange juice, because there's no, all the bulk's been taken out, it goes directly to your stomach and immediately spikes your insulin, because natural sugar spikes your insulin as well. Mm-hmm. And then very quickly, what you don't use, that gets converted to fat. Versus eating an orange, where you have bulk, it still spikes your blood sugar, but not nearly as high, and the bulk helps lower the amount of sugar that gets absorbed into the body. Right. But we're specifically talking about added sugar. So when I talk about 41 teaspoons, that's what is consumed on a daily basis. It is so difficult to find foods that don't have sugar in them. Yeah. I mean, and the crazy thing is, don't buy a item like ham or bacon and assume that it doesn't have sugar in it.
Right.
So you say, well, I had bacon for breakfast. Well, believe it or not, oftentimes providers will add sugar to the bacon. And why is that? Sugar is the most addicting substance on earth. And so when you consume sugar, it spikes a chemical in your brain that makes you feel good. Mm-hmm. And so if you eat a piece of bacon, which I love bacon anyway, but then you add sugar on top of it, your endorphin levels fly and you say, oh my goodness, that was so wonderful. And so what does your brain say when your endorphin levels go back down in a couple hours? They say, I need more bacon, but I need bacon with sugar.
I need that brand
That's
specifically.
that brand specifically. So again, every single thing that you put in your cart at the grocery store, you need to look and say, does it have added sugar? And it's in grams of sugar. That's how it's described on the package level. Like Annabelle mentioned, the recommendation is 25 grams or less, which is 6 teaspoons. That is very difficult. You will find, and I'm going to give yogurt, I'm going to talk about yogurt here. I love yogurt, and a lot of people love yogurt as well. But yogurt is notorious for having large amounts of sugar added. Most people probably have had plain yogurt, and people don't like it because it's very bitter and it doesn't have added sugar in it. It does, but not very much. Most plain yogurt has about 7 grams of sugar.
Of natural.
Sugar,
in the
right.
milk product, yeah.
But it's not added sugar. So I encourage you, if you're going to have yogurt, is to have plain yogurt and then add some honey as a sweetener, because honey is much more safe, that's not good English, it's much safer than added sugar.
Yeah.
But yogurt, and I'll use Siggi's is kind of my go-to brand. I love Siggi's. And vanilla Siggi's is my favorite. But even that has 9 grams of added sugar to sweeten it up. So the thing is that when you think about 25 grams, so that means if I have 3 yogurts a day of Siggi's vanilla, I'm over my limit. That's how difficult it is. Now, you say it's impossible. It's not impossible, but you have to pay attention. Annabelle mentioned, can you get down to 25 grams a day or less? It's difficult. So I oftentimes tell my patients, use 50 grams, which is 12 teaspoons. And Annabelle mentioned, if you go from 41 per day and half it, that's a significant benefit for you and your baby.
Yeah. So definitely decreasing your amount of added sugar. So again, on the nutrition label, there will say sugars and then added sugars. So decreasing that simple sugar. But there is something else we can do. You know, we don't want to just take away all this sugar and say starve to death.
Yeah.
Protein and fat and whole carbohydrates. These are our 3 macronutrients that are so important to have in every meal. So even when we're having a banana, it's important to add fat and protein. And I know fat has been this just scare for all these years, and people think if I eat fat, I'm going to get fat. But fat and protein have huge benefits, and eating a lot of protein and fat with whole carbohydrates in your meal will help you to get to a point where you will, pass your glucose screening.
Right.
So what are some things that they can do to add protein and fat, and what are the importance in pregnancy?
So obviously you're building a human being, your baby. And it's interesting, after everything is created in that first 6 to 8 weeks of life, the brain and the neural system and the eyes, all those wonderful things that makes them human, basically from that point on, you're growing your baby. And it's no different than I'm growing a plant, I'm growing an animal in the barnyard. It's the same concept. I know that's kind of archaic to say, but you're growing an individual, and you have to treat them with love. You give a plant water, you give a plant food, you give a plant sunlight. So that same thought process should apply to your baby. Most people are that way. Most people want to grow their baby in a safe manner. What happens though, it's not that people don't want to, you don't know what you don't know. And so we as a nation have not done a good job of educating people on what is safe, what is desirous, what is in need for the benefit of them and their baby. And so Annabelle mentioned 3 macronutrients in every single thing that we eat: fats, proteins, and carbohydrates. In general, every single food has some degree of those. Now, there is no doubt a piece of steak does not have carbohydrates. Yeah. But most everything that we eat in a given meal will have all 3 of those macronutrients. We collectively as a family, we collectively as a medical practice, encourage ourselves and people that we come in contact to increase their fat content, their protein content, and try to lower their limits of carbohydrates, and for sure to minimize their amounts of intake of sugar. So in general, all three, fats and proteins and good carbohydrates, are all good for you, and they're needed for your health and for your babies. The amount of fat that you consume is important that you have that every day, but it's got to be good fat. It's got to be lean fat. So chicken, turkey, lean pieces of beef are all going to be beneficial for you and your baby.
And what about oils? So like olive oil, avocado, butter, are these good?
These are good. And it's important to understand that I use history as my guide for much of what I do in my life. And throughout history, people have eaten, almost bad English there, people have eaten butter. Butter is healthy. For sure, you do not want to eat margarine. Margarine is terrible for you. You should never consume it. When you go out to dinner, oftentimes they will serve you what you think is butter, but oftentimes it's margarine. And you need to say to the waitress, will you please bring me butter? And sometimes they can, sometimes they can't. If they can't, stay away from the margarine. Do not use it. But butter's healthy. But if you need an oil for cooking that I think is the best, I would encourage you to use olive oil. Remember, Jesus used olive oil. So I think it's very, very good for you. Olive oil and avocado oil. Both of those are very, very healthy. People say, what about coconut oil? I think coconut oil is good as well. But those three fats are very, very beneficial for you, and I encourage you to use those. I want to specifically talk about protein consumption. Now, counting protein grams in a given day, I think is important. Most Americans do not get nearly enough protein in their diet to benefit them, and especially don't benefit their growing baby. What is the best amount of protein that's needed? Everybody's different, but you need a minimum of 80 grams of protein per day. Most Americans end up with about 30 or 40 grams of protein per day. So about half of what you really need is a minimum. And then bumping up your protein above 100 grams is very, very beneficial. So there's lots of ways to get protein. That's a good assignment for you to go out and find out how I can increase my protein consumption. Because when you read about consuming protein, you're going to be reading information that's going to benefit you. But I want you to count your protein grams per day. 80 is your minimum, whether you're pregnant, but especially in pregnancy, and really consuming 100 grams above or greater. Now, I'm going to point something out I think is important. When you consume large amounts of protein, you slightly increase your risk for developing kidney stones. And so one of the things that I encourage you to do with high protein consumption, which should be done every day, is you need to consume adequate amounts of water to flush your kidneys. And what is adequate amounts of water? 80 ounces. So you need 80 grams of protein, you need 80 ounces of water to help flush that through.
So that 80 of water is just your minimum. I mean, that's just to balance out the protein. But then on top of that, we're talking about sugar, which brings us into the water. Water is a great way to balance your blood sugar. So let's talk about water and exercise when it comes to blood sugar.
So it's interesting. So exercise is the single greatest benefit to regulate insulin in your bodies. And it's through a complex mechanism. And I don't want to get into that because it's so complex you about need to go to medical school to understand it. But in general, if you understand that type 2 diabetics are encouraged by their healthcare provider to exercise and get their weight down. Because when you exercise and you get your weight down, you're going to bring your overall insulin levels down. So lowering your blood sugars with exercise is paramount importance whether you're pregnant or whether you're not pregnant. And so this is a simple thing that you can do. You eat dinner, and most people are either at home when they eat dinner or going to be coming home shortly thereafter. And so I would encourage you to make it part of your lifestyle that when you eat dinner at nighttime, that you go for a walk around your neighborhood. And you need to walk to get your heart rate at least to a level of around 100 or greater, preferably around 120. So if you're walking so slow that your heart rate's not even to 100, you're walking too slow. And try to walk about 1 mile. What this does is it will bring your blood sugar down. And remember, whether you're pregnant or you're not pregnant, that sugar does two things. Number one, it makes fat if the cells are full. And number two, it stimulates your baby to grow if you're pregnant. So lowering your insulin will benefit your fat, decreasing it, and will benefit your baby in lowering its overall weight.
Okay. Yeah. So after eating a meal, going for a walk, heart rate increased, go for at least a mile, and make sure that you're drinking lots of water, especially after your meal, especially if you're pregnant, especially increasing this protein. So you really want to be drinking in a day over 100 ounces of water by the time you add all of these things up.
So it's interesting. I've mentioned this frequently to my patients through the years. It's hard to get enough water. And part of it is because we don't want to drink out of the faucet and we don't really have water available. So as an accessory, all women to speak of carry a purse or a backpack, and they carry it with them wherever. If you accessorize your water container, you will have that with you. So get on Amazon, go to Walmart or whatever, and buy an accessory water bottle that you're happy with. I encourage you to get the metal ones, stay away from the plastic ones, and have that with you at all times. If they're cool, if it's with you, you will use it. But if you don't have one, oftentimes it's hard to get to that 100-ounce mark. Mm-hmm. Remember, a gallon of milk is 120 ounces. That's 1 gallon. So basically, we're encouraging you to drink about 4/5 of a gallon of water. So this is a water bottle that I'm pleased with. So all Hydro Flasks come in different ounces. This is an 18 ounce, and I like the size because, again, this can fit in your purse, this can fit in your backpack. So you need about 5 to 5.5 of these per day. And so again, that's not a big deal. When you get up in the morning, you have, again, you can use this at home. You drink this all in the morning. Remember, you've gone NPO. You haven't drank anything through the night, so you're already dry in the morning. You check your urine, it's dark yellow. That tells you that you're dry, okay? So you're going to want to drink one to two of these first thing in the first several hours of when you're awake. How do you know if you're drinking enough water? It's very simple. You look at your pee. If your pee is yellow or dark yellow especially, you're dry. And if your pee is clear, you're getting adequate fluid intake. It's important to understand that as your pregnancy advances, if you're dry, you're increased risk for having contractions. Contractions are no fun from an anxiety standpoint, plus they hurt until late in pregnancy. The other thing about drinking enough water is if you don't drink enough, you're at increased risk for developing a bladder infection or a kidney infection during your pregnancy. I can tell you, every pregnant woman, they do not want to develop a kidney infection. It causes a lot of pain. They have to be admitted to the hospital, receive IV antibiotics, so you want to stay away from that. So again, water's the key.
Okay. Yeah, so this is a lot about gestational diabetes and really just the nutrition. If you're thinking about pregnancy, start these practices now. If you're in early pregnancy, we really want you to start these practices. Think about the baby that you are growing inside of you that is relying on you to be the one that puts in those nutrients into your body to feed your baby. So think about what you are doing, what you are accomplishing. We really want you to click the link below and sign up for the pregnancy online class that will just dive deep into lots of different things in pregnancy to definitely have a healthy pregnancy. So do you have anything else for him today?
No, this is probably one of the single greatest topics for all Americans. But again, our goal for you is a safe, safe environment for both you and your baby throughout your pregnancy. So good luck.
Yeah, best wishes. We'll see you next time.
Bye-bye.